Good evening and welcome to our COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Today, controversy brews over Kano Isolation Center as government dismisses viral video reports indicating an empty isolation center. Assessing the status of community testing, we look at how far states have fared in the COVID-19 fight. And Egypt Health Ministry accused of negligence over COVID-19 deaths. In line with the national case definition, testing in Nigeria is for anyone with a travel history outside the country, one who presents with fever, cough, or breathing difficulties within 14 days of arrival, or anyone who has symptoms and is a contact of a confirmed or probable case, or anyone with either cough, difficulty breathing, or shortness of breath in an area of moderate or high COVID-19 prevalence with no other explanation for the symptoms. These are the categories of persons tested, and thus far, the Nigeria Center for Disease Control has conducted almost 50,000 tests in Nigeria. Recently, the Presidential Task Force on COVID-19 and the NCDC have identified the infection transmission rate is at the community stage. With the active case searches, the surveillance taking place across the country, later on the program, we analyze the efforts and support needed for sample collection, transportation to laboratory, as well as the realities of community testing. Nigeria recorded 299 new cases of COVID-19 in 14 states and the Federal Capital Territory, bringing the total number of COVID-19 infections in the country to 8,068. According to the NCDC, a total of 2,311 patients have been discharged from various isolation centers across the country and 233 deaths recorded. Here's a breakdown of the figures by region, showing Lagos leading in the southwest and Nigeria with 3,595, followed by Kano State in the northwest, 919. The Federal Capital Territory is next in the North Central region, maintaining the third highest tally with 519 cases. Borno leads in the northeast, Edo in the south, and Ebonyi and Imo now lead in the southeast, having equal number at 33 cases. And even though Kogi State has no record of the coronavirus, the state government has procured over 5,000 testing kits, which it says is capable of delivering results in 30 minutes. The Commissioner for Information and Communication, alongside the National Assembly member from the state, believe that this is a feat which could challenge other procedures adopted by other states. The Kogi State government also secured materials for the protection of the frontline health workers against coronavirus in the state, adding that the hazard allowance of medical officers have been increased.
We are not at loggerheads with anybody. We have testing kits. We have procured 5,000 testing kits from one of the best vendors in the world. And it is working. NCDC testing kits work in hours. Our own will give you result in 30 minutes. And it is something that you can even get, you can even do it on your own, like the normal HIV tests. So that shows that we are moving ahead. We have also procured facilities that will safeguard and protect our medical officers that are on the front line of this fight against coronavirus. We have increased the hazard allowance of our medical officers, and we urge our people to continue to take precautions because we know that this COVID will soon fizzle out and we will return to our normal life.
Nobody is inside. The 300 seater.
The video you see is one that appears to have gone viral on social media, showing what is believed to be the state of an isolation center in Kano. It's clearly an empty hall with no equipment, and those behind the video say that the state government have no capacity to handle any COVID-19 related case.
Look at this here.
Well, enraged by this video, the Kano state government has dismissed it as the handiwork of people who, according to the Commissioner for Youth and Sports, Mr. Kabiru Ado, do not wish the state well. He says that the Sani Abacha Stadium Isolation Centre is still under construction, but that there are equipments in it and that the state government is working with the Nigeria Centre for Disease Control to keeping Kano citizens free from COVID-19.
We are disdained and disgusted by the video going viral that some element claiming that this isolation center is non-existent, it is not completed, it's not whatever accusing the state government. And I want to believe that anybody who is doing that must be somebody who doesn't care with the health of Kano people, who doesn't control his emotions, but rather he go astray. This is an indicator of ignorance, that he doesn't know what the state government is doing. And it is the general knowledge of everybody, not only in Kano, but in the country at large, that His Excellency the Executive Governor of Kano State and the Kano State government is making all effort, is making proactive measures to curb the menace of these deadly diseases. And seeing this viral is an indicator that still there are some elements that doesn't fare good for Kano people.
Let's update you with the latest efforts across the country to stopping the spread of COVID-19. We begin as lockdown order continues tomorrow in Katsina, Daura, also in Batagarawa, local government areas of Katsina State, effective 7 a.m. This is coming barely a week after the expiration of the period of relaxing the lockdown by the state government for the Muslim faithful to celebrate the Eid al-Fitr festival. Governor Aminu Masari announced this today at the General Muhammadu Buhari Government House while highlighting the progress made so far in the fight against COVID-19. And in a bid to mitigate the effect of COVID-19 pandemic, the United Nations High Commissioner for Refugees, UNHCR, in collaboration with the National Commissioner for Refugees, Migrants and Internally Displaced Persons, have presented items worth millions of naira to thousands of Cameroonian refugees who are seeking asylum in Adago and Ukende community. The items include 5,000 buckets, hand sanitizer, soap, face masks, among other items. And as part of their contributions to curtailing the spread of COVID-19, members of the National Assembly caucus from Plateau State have made a donation, an undisclosed amount, to complement government's efforts in the fight against COVID-19. Similarly, other donations, an ambulance, ventilator machine, surgical face and nose masks, as well as gloves, hand sanitizers, were also given to the state government by the Nigeria Oil and Gas Industry Intervention. And following the ban on motorcycle operators, popularly called Okada, in Bauchi State, the government procured 350 tricycles to be distributed to commercial motorcycle operators through a hire purchase scheme. The ban on Okada in the state a month ago was a response to the COVID-19 pandemic as one of the measures taken to entrench physical distancing. And in the wake of research and development as the world races to evaluate the safety and efficacy of drugs and drug combinations against COVID-19, Dr. Mary Stephen, a technical officer with the Health Emergencies Team, the World Health Organization Regional Office for Africa, Congo, Brazzaville, joins us now via Skype. We'd like to thank you, Doctor, for joining us on the program.
Thank you. Good evening. Thank you for having me.
I'd like to begin with less than 6 months into this emergency response to COVID-19 on the African continent. What's your assessment as to how countries have responded so far?
For Africa, as you can see, the situation is still evolving. We haven't seen the peak of the outbreak yet on the continent, but Africa is the continent that is reporting the least number of cases. So we have like 115,000 cases, over 3,000 deaths, and over 45,000 recoveries from all the 55 countries in Africa. So, but Africa has implemented early action, and this has helped to slow the progression of the outbreak on the continent. So if you look at the predictions previously made and the situation currently in Africa, it's more than 3 months now, and the cases are still very, very few. So this is as a result of the action taken early on during the outbreak on the continent. But of course, the situation varies from country to country. We still have countries that have less than 100 cases, and of course, countries that are reporting high number of cases, and the large proportion of these cases are coming from about 5 to 6 countries, including Nigeria.
Dr. Stephen, let's look at the race for a vaccine. We've seen some discharged patients in Nigeria, notable political leaders as well, confirm the efficacy, if you will, of hydroxychloroquine in treatment of COVID-19. But with the WHO suspension of trial, should treatment with the drug be on hold?
Yes, so in March 2020, WHO launched the Solidarity Trial for COVID-19, and this involves 4 treatment regimens. So one of the treatment is remdesivir, one of the drugs that was discovered and being used for Ebola treatment in DRC. The second treatment is lopinavir, ritonavir, which is HIV drug already being used for HIV treatment, and a third combination is lopinavir, ritonavir, and interferon, also a HIV treatment, and then we have the chloroquine and hydroxychloroquine. So these 4 regimens were being used as part of the Solidarity Trial. So over 100 countries have indicated interest. In Africa, we have about 31 countries that have indicated interest, but so far countries in Africa have not started officially enrolling patients. We have over 400 hospitals with about 3,500 patients in over 17 countries globally being enrolled in the Solidarity Trial. So following evidence on the issue of safety with regards to hydroxychloroquine, there has been a review, and then the drug has been placed on temporary suspension. So basically, the reason for the trial is to determine the quality, safety, and efficacy of these drugs as it regards to COVID-19. Yes, we know they are being used for other disease conditions, but they have not been tried before for COVID-19, and this was the reason for the Solidarity Trial. And of course, if you're doing a trial, any drug that tends to be gives more side effects than benefit to the patient, definitely it will be suspended until further analysis has been done of the data on the safety.
All right. Last week, the UN issued a policy brief outlining the impact of the pandemic in Africa. It insisted that, countries on the continent, like everyone everywhere, should have quick, equal, affordable access to any eventual vaccine and treatment. But a lot of people wondered if there was a threat in the first place that perhaps Africa would be the last place to get the vaccine.
Okay, so there has been discussion at global level on equity for potential vaccine that might be discovered, and so Africa will also benefit from any vaccine that is discovered for COVID-19 as much as any people from other parts of the world. So there has been a lot of research ongoing, but unfortunately on the continent there is no single research in terms of the use of vaccine for COVID-19. But when this vaccine is discovered, we know that WHO is working to ensure equity in terms of distribution of these vaccines to all the countries of the world, including Africa.
All right, Dr. Mary Stephen, we appreciate your time on the program. Many thanks. She's the technical officer with the Health Emergencies Team, the World Health Organization, Congo-Brazzaville. Thank you for joining us.
Thank you.
Still to come, we have more on the global COVID-19 response. Join us again. Welcome back. Let's bring you this update from our correspondent, Babajide Agbeyo in Ekiti State, on efforts of the government in containing community spread.
The government of Ekiti State has been making efforts to ensure there is no community spread of COVID-19 in the state. And one cheering news is that the people themselves have taken it as a responsibility to raise the alarm, to take to the whistleblower approach each time a new entrant is noticed in the state with strange feelings. And on many occasions, the task force had been able to swing into action and get such people to be isolated. But one area that more effort will still be required is in getting the borders properly locked. Yes, there is lockdown, but people have been entering into the state, and this will have to do with the security officials manning the borders.
The security men are doing their job. I think they be trying to. The people need to be. They need to be forced to comply with the rules and regulations of the government, associated this COVID-19.
We are all in this together. While enforcing the lockdown, you can at least let your human side still be visible. You don't treat us like animals or that we are the cause of the situation. I still think there's need for them to respect the basic human rights of the citizens.
But by and large, the people of the state are hoping and praying that very soon the state will overcome this pandemic, and Nigeria and even the world at large. But their own responsibility at a time like this is to ensure the rules are complied with. And in Ekiti State, that is being done substantially. People are using the face masks as expected. Social distancing, to a large extent, people are keeping to that. Then the prayer will just be that the world will overcome this as soon as possible. Babajide Agbeyo for COVID-19 update.
Thank you, Babajide. Mass community testing is set to be crucial to the COVID-19 response. Experts say governments must test a large percentage of their populations to fight the coronavirus. But what steps can Nigeria take to roll out testing? And that's on a large scale. Dr. Bidemi Awodele, a public health physician, joins us here in Lagos. Welcome to the program.
Thank you for having me.
So how do we build a pipeline of testing capacity with what we've been told are limited resource?
It's a tough one. With COVID-19, nothing really is straitjacketed. And as we go on, we move, we see what is going on, and then learning from others around us. But with the testing, I would want to say Lagos State actually blazed the trail by testing, decentralizing the testing, and collecting samples from the 20 local governments. However, that is not enough. And so we have to think out of the box. There's so many things going on now. However, for the rapid testing kits, we need to look at it carefully so we don't run into troubles. There are so many test kits. One click of the computer, you can see all sorts of things. RDTs claiming you can get your test in as much as 10, 15 minutes.
Yeah, like what we heard from the Kogi government.
It for quality control. And then we need to get a test that will be very, very sensitive. And what I mean by sensitive is that a test actually showing the virus is there. So we don't have a lot of false positive, because if we have false positive, it's going to take us back in the fight against COVID-19.
If we look at the country's epidemiological report, you've said Lagos is a trailblazer, but for other states, which would you say is next in line to Lagos?
That's a tough one. That's a tough one. But I think initially in the fight against COVID-19, the FCT was also churning out results. But now, when you put on the TV, you see all those results coming in. So I think with time, using Lagos State as a yardstick, most of these states are ramping up their testing capacity. But that is not to say even Lagos State cannot do better. And so that is in the pipeline. If Lagos State seeing what we have now, we're about 20 million. So 20 local government sites, testing collection sites, and then NIMA and IDH is not enough. And so we need to think out of the box.
Exactly. And some people are saying, let's, more innovative solutions, homegrown. But can there be such examples when it comes to testing? And if we're planning to, or sticking with the reliable mode of testing,
yes, why
which
not?
is the RT-PCR?
Why not? Initially in the testing, regarding that testing collection of samples, the VTMs, the viral transport media, we started thinking of what to do, and we were able to get something homegrown, and works as fine. And so it just depends on, also I would also chip in this, we may also need to think out of the box, like I actually said, regarding the private people, we may need to bring them on board. There are a couple of world-class laboratories, because going forward, it's looking like COVID-19 is not going to end anytime soon. And so we need to sit down together, public, private, try and brainstorm to tackle this menace.
All right, we appreciate your time, Dr. Bidemi Awodele, a public health physician. Thank you for joining us.
Thank you.
Doctors have accused Egypt's health ministry of negligence in its handling of COVID-19, saying it bears full responsibility for medics' deaths. The union said that 19 doctors had so far died from the disease and more than 350 others had been infected. It blamed a lack of personal protective equipment and beds for seeking staff, warning the system could collapse. The health minister insisted sufficient protection had been offered and medics had received the best possible care. Egypt, the most populous country in the Arab world, has so far reported over 17,000 confirmed cases and 783 associated deaths.
With more than 5.5 million COVID-19 cases and over 346 deaths worldwide, scientists across the world are working frantically to find a vaccine and treatment. In a promising development, a drug treatment that appears to shorten recovery time for people with coronavirus is being made available on the National Health Service in the UK. Remdesivir is an antiviral medicine that was originally developed to fight Ebola. UK regulators say there is enough evidence to approve its use in selected hospital patients. Meanwhile, the latest UK figures for COVID-19 deaths are the lowest for 6 weeks, with 4,210 registered in the second week of May. Deaths in care homes in England and Wales accounted for almost half of the total number. Over in Latin America, following the Trump administration's decision to bring forward new travel restrictions on Brazil by 2 days, Brazilians scramble to make last-minute arrangements to get into the U.S. The restrictions apply to foreign nationals who've been to Brazil in the last 14 days. Brazil has the second highest number of coronavirus infections behind the U.S. and the sixth highest number of deaths in the world. Meanwhile, Brazil says it won't change its recommendation to use a malaria drug to fight coronavirus, even though the World Health Organization has suspended trials of hydroxychloroquine because of concerns that the drug could cause heart problems in patients and increase the risk of death. President Vladimir Putin says Russia has passed the peak of coronavirus infections and has given his defense minister the go-ahead to prepare a postponed World War II parade in June. Russia has the third highest number of cases in the world, with over 362,000. And finally, the Church of the Nativity in Bethlehem has reopened as the West Bank eases its lockdown.
This place is the holiest place. This place is the place where our Lord Jesus was born more than 2,000 years ago. The birth of our Lord Jesus Christ gave hope to people more than 2,000 years ago, and opening the church today, I think, will give hope to the whole world that hopefully this pandemic will end not only in Palestine but in the whole world.
Amidst lingering pandemic concerns, the church is capping access to 50 people at a time and requires that they are free of fever and wear protective masks.
Well, according to the NCDC, taking ownership and collective responsibility is important as we fight the virus. 2 new labs have been activated for inclusion in the NCDC molecular laboratory network, that's in Ogun and Katsina, bringing the total number of labs with COVID-19 testing capacity to 28. You can find the latest guide on their websites. The same with the World Health Organization, the latest update on the global response to the COVID-19 strategy. You can take a closer look at some of the numbers there in real time. ChannelsTV.com, our website, has more updates. You can find the latest on the pandemic in Nigeria and across the world, plus other stories. Thank you for watching. I'm Millicent Nwaka. Stay safe, stay healthy.